So one of the first steps of what we're wanting to do is create some more definition along his jawline. Now that I have his neck turned in this position, he clearly already has pretty good definition, but when I've got him sitting directly straight up and looking, we can find that we just lose a little bit of definition as we move centrally, and we have a little deficiency in that central portion of his chin. But in order to keep him balanced and harmonious, I want to work on giving him just a little bit more posterior width on that jawline to keep it looking nice and masculine. We're going to do a cannula type technique and start with using some voluma first through the jawline. So my technique itself is going to be to just port and place my needle. This looks like a long needle, but we're only going to use just the very, very tip of it just to create a little definition. So a small little pinch. Good. And we can see a tiny little drop of blood. That's where we know where our little hole was. And now we're going to just thread the needle, so to speak, and just work on getting right in to that tissue. Okay, just like that. And we're going to go right down onto his, what we call the mandible or the jawbone. You can feel us working right through. Very little resistance at this point. And we're just going to kind of keep working our way through. Our patient, you can see, is doing really well. He's quite comfortable. And we are now, I can feel with my tip of my finger, we can actually tent and see we're all the way back here along his jawbone. And now we're going to start to just place some product, and he's doing fantastic. Just nicely laying this right along his mandible. Just carefully, you can see we're starting to create some nice fullness back here. Good, and we'll take a look. So you can already see that we've started to just create this nice raised edge right here along his mandible. And we're going to keep working and work centrally now.